Good morning to you.
Good morning.
Now, we had booked you without knowing what was going to happen last night.
Well, there's enough stuff going on with MNsure all the time that you're pretty safe.
Yeah.
Right. And so
plan to do a MNsure show. And I just wanted to clarify, it's not necessarily Kenny G, but I'm pretty sure it's a Democratic donor because they've been really good at handing out things. Wow.
Which surprises me that they'd be handing stuff. Of course, this is handing out taxpayer money. I was going to say they shouldn't be handing anything out, given that the DFL Senate was just fined $100,000 for cheating.
Yeah, but I'm guessing a couple phone calls and they made that back up. And
They are the
by
party
way,
of the rich.
They had over $300,000 of contribution violations, but they only had to pay $100,000. So they're up. Oh, and they have majorities. So $100,000 doesn't sting really bad when you end up on the good side.
It was worth every dime for that, I guess, if you don't mind cheating.
We'll get later into all of the problems that still plague MNsure, Minnesota's version of Obamacare. But last night, the board of the board of MNsure met in what sounds like a video conference that a lot of them didn't make it to the building itself. For an emergency meeting with the former director of MNsure, April Todd Momlov. And there she gave her resignation. It was something like a 2-hour meeting. And she stepped down. She was under pressure because of a vacation she took, 2-week vacation in November during all of the problems with MNsure. Now, is she resigning because of the vacations or because MNsure's bad? Because I would have fired her for MNsure not doing what it promised.
Well, and I don't really care if she resigned or not. I don't think that is the fundamental problem here. And technically, the board accepted her resignation. That's the only information that I got from this. But I don't care that she went on vacation. MNsure was falling apart. She shouldn't have done it. It shows exceptionally poor judgment. But for over a year, MNsure has been missing milestones, and we haven't been getting transparent answers. And I really think that the problem is with leadership. It's with Governor Dayton, it's with his commissioners, and now that the board is in place, with the board not digging down into finding out why things keep failing. Because if you paid attention to the presentations we had during the legislation, as the legislation was moving forward, we would ask questions and we would get a song and dance, and the DFL would vote yes. And then as things started falling apart, when we asked more questions, we were called obstructionist. And lo and behold, a couple weeks later, something else would fall apart. And so as we kept going forward and pointing out questions, nobody who was in a leadership role in the rollout of MNsure was actually paying attention to the bad things that were happening. And then when they happened, they thought it was because Republicans had pointed them out.
Well, and State Representative...
These wouldn't be problems if we just ignore them.
State Representative Carly Moline last night on Twitter, DFLer from the Iron Range, took the obstructionist ball and ran with it. Apparently, what you say is true, that if Republicans questioned anything, and apparently questions that weren't answered, that was getting in the way. Trying to find out what this legislation would do, trying to find out what their plans were, if there were problems. Apparently, that was getting in the way.
Well, and this starts from the federal rollout forward. The Democrats in Washington decided they were going to do this. And when basic free market principles were brought up, when normal human behaviors were brought up, and it was pointed out that this is not sustainable, it's not going to work, it's not going to perform the way that somebody white papered it out and presented to you, they just walked away from Republicans at the table, passed it, and now all of the things that we talked about being a problem are coming to fruition. So Minnesota is a microcosm of what is happening on the federal level. And when things aren't going well, Harry Reid goes right to obstructionism, Carly Moline goes to obstructionism, Representative Moline, Governor Dayton name calls and says the only thing we're out to do is destroy MNsure. No, we're out to keep people from getting hurt and quit wasting money.
Let me ask you this, Senator. How does, with the Democrats controlling the governor's office, the state Senate, and the state House of Representatives, Republicans in the minority in both of those bodies, not having the governor's office, how exactly can you be obstructionist?
Yeah, how can you destroy MNsure if even the Democrats in the House and Senate have no authority over MNsure? It's an independent body with no oversight.
Well, there is no oversight on the board. The governor has the authority to appoint and ask for the resignation of people on the board. And one of the problems with board structure, and this again, Republicans pointed this out, there are no insurance experts on the board. So when
there's no website upstairs either.
Well, and there's no IT expert on the board.
They're mostly really good at fantasy baseball.
I was going to say, so are they just a bunch of idealists or ideologists, and that's how they're judging this program?
They have skills. Some of them have private sector experience. One was a union rep.
Well, that's good to have.
Yeah, exactly. Especially
that makes
when
a lot of sense.
The union that he used to work for will never be impacted by MNsure, so obviously he should have a seat at the table.
Clearly. His voice needs to be heard.
But
if the exempted voices aren't heard.
Yeah, the board not having people on it that actually understand the most critical part of the rollout is part of the problem, because there's such a steep learning curve in this. You have to remember the people in the legislature, Republicans in particular, have been digging into this since 2011, understanding it. So the board gets put in place, but nobody with any background in insurance, actuarial science, IT management. So they've got this huge learning curve, and pretty easy to get snowballed and told everything is going okay. And now as we're getting into crunch time, the higher the pressure is, the more obvious the cracks and flaws are. That's what's happening right now. And so I hope that with the resignation of Ms. Malmov, the board actually takes ownership and starts pushing back, and that Commissioner Lights will dig in and actually make it his goal to get insurance cards into the hands of Minnesotans by January 1st.
Do you want to, when we come back, do you want to go through the problems with MNsure and help us think through them?
Sure, let's
do that. All right, that sounds great. We're sitting here with State Senator Michelle Benson talking about MNsure, the resignation of April Todd Momlov. That is Siri-free.
Good morning.
And her sweater, 651-989-5855.
Merry Christmas.
Jack and Van up and at 'em.
Aruba, Jamaica, ooh, I wanna take you. Bermuda, Bahama, come on, pretty mama. Key Largo, Montego, baby, why don't we go? Jamaica, off the Florida Keys.
All the places April Todd Momlov will get to go now that she doesn't have a job.
The executive director of the MNsure, Minnesota's version of Obamacare, April Todd Momlov, resigning last night after her 2-week vacation to Costa Rica. After months of an error-prone website and bureaucracy, MNsure has not been running smoothly. And when things aren't working, when people aren't getting the insurance that you've been promised and you go on a vacation, people are going to demand that you resign. And she did. But
unless you're Sebelius.
You
can run that thing into the ground, right?
But this is
maybe
more
the
than
captain should go down with her ship.
Well, this is more than just someone running a bureaucracy going on vacation at the wrong time. This is someone who did a terrible job of building a bureaucracy and a website that could do what it was promised
before the vacation. Right. Yeah.
And so we have Senator Michelle Benson in this morning. Good morning. In order to tell us exactly what has been going on with MNsure, Momlov aside, vacation aside. What has been going on with MNsure that has made it so difficult for people to get insurance through this exchange?
And if you've got a question for the senator, give us a call, 651-989-5855. The number again, 651-989-5855, or tweet it with a hashtag TCNT. Problem, Senator.
Yeah. Well,
if you have solutions, that'd be good too.
The inherent structure of what Washington, D.C. imposed on Minnesota and the Dayton administration embraced, as free market economists will tell us, forcing people to do things they don't want to do isn't a good idea. But beyond basic economics, let's look at they tried to build a massive IT infrastructure without considering what was actually going to happen to the people who were using it. And they took on far more than they needed to. There are states where these rollouts have been successful. And in fact, a contractor that walked away from the Minnesota contract is running some successful state rollouts. There was a way to do this well.
Senator, how much did this failure cost the taxpayers?
You know what? I don't have the total numbers right now. 170 million in federal grants was the last I heard.
That's good enough.
There have been more federal grants applied for. There will be some general fund money going into it in 2014.
We keep screwing up. Can we have more money?
That's the way government works. In the private sector, you get fired or your contract is capped, and they say, sorry, you told us you could do this. You figure out how to pay for it.
I mentioned this earlier in the show, but I'll bring it up again. We talked about the hour-long wait on if you call MNsure, and after an hour, apparently it's state law, state code, state custom, state rule that after an hour they hang up on you.
Well, that's because they don't want you just sitting there listening to cool music for an hour.
Well, shouldn't they?
In private sector healthcare, the limit for being on hold is 2 minutes.
Well,
2.
and just best practices. If you call your bank and they said, no, you're going to be on hold for an hour and we'll get to you when we feel like it, you'd leave that bank.
Yes.
The problem with government is that when it's your only choice, you have to put up with an hour hold. Now think about this. This is supposed to be for people working who don't have insurance on their own. If you get a half-hour lunch break, how do you spend an hour on hold to try to walk through your insurance problem?
Right.
If the website's down all the time, how do you even create an account? They are not focused on, they don't have to be focused on customer service because their goal is to complete a political objective, not actually to serve citizens.
Right. And I get health insurance through, right now, my wife's employer, and a lot of people do, and a lot of people are going to be just fine. Yes, it's going to cost them a little more, but they're still going to have health coverage on the first. If you are depending on the MNsure website or healthcare.gov or the phone number, and you can't get it done and you can't get a plan come January 1st, you don't have health insurance for a lot of people.
And we're already seeing this. There are some clinics that are already seeing people who believe they signed up for insurance through MNsure and are getting frustrated. So that first week of January, there are going to be hospitals and clinics. And this is, just my visioning of it. Somebody's going to have a screenshot from MNsure, and they're going to walk in and say, but see, I signed up. And then what's that hospital or clinic supposed to do? Now, if it's a non-emergent situation, you have a receptionist explaining, no, you actually have to have an insurance card. And so think about those people. And the people in St. Paul can just say, well, we did our best and not be held accountable.
And what if it is an emergency and they have to be treated? Somebody has to pay for that.
Well, they do get treatment. Absolutely.
Right, but somebody has to pay for that. I mean,
Exactly.
They get treatment.
Well, that is the problem, though, right now. I mean, that's the whole, if you look at the ideology of why Obamacare and why MNsure, is they want to reduce emergency department visits. They want people to be healthier. But the problem is government is trying to change people's basic behavior. You can't change people's basic behavior. A lot of that is their own responsibility and their own choice. You can't incentivize, what they're trying to do is they're trying to incentivize the health institution to give reimbursements for healthy people. Well, that's fine in theory, but it doesn't work out the way they're planning it.
Well, and if you're going to try to change people's behavior and funnel people through a website or a phone number, it's good to have those working.
Well, and the emergency room visit issue, a lot of those people are already on a public program.
Right.
So by engaging in something like a coordinated care delivery system, which the Pawlenty administration started working on, where individuals were actually sort of retrained in how to access health care.
Health homes.
That considerably reduced emergency room utilization for those people who were in those coordinated care systems.
Let's talk about the people who are already on some kind of public, involved in some kind of public program to get their health care. For the people who are, do you have the numbers on folks who've signed up for MNsure? Because a lot of those folks are people who were already being served through a different public program.
Right. And the latest thing that I have is the 25,000 people actually enrolled. So they've completed all of the things they need to do in order to get to the point where health insurance can be handed off. But of those 25,000...
Have they paid for it?
Not yet. Only 4,000 are private market insurance contracts. And so the remaining number will be public programs, people who were already eligible for public programs or were already in a public program.
So it's 4,000 then?
4,000 is the latest number I have for private market insurance. And
are those people ones that they have a care coordinator that is hooking them up to MNsure as opposed to going and searching this out themselves?
Of those 21,000, I'm not sure how they got there. And one of the things that MNsure doesn't ask, of all the things, they don't ask if you were previously insured or not.
Okay. So 4,000, you take the people who are already on a public program, government program out of it. We have 4,000 people.
Right.
For at least $170 million.
Yes.
Right?
Yes.
And we think it is more than that. We're just not sure how much more than that to get health insurance for 4,000 people.
Right.
That's madness.
This is the problem. The objective
I do some math
was
real quick. It's going to take me 45 minutes to do the division on.
The objective was reduce the uninsured, reduce cost, and increase access.
Has it done any of that?
And they've accomplished none of that. It has gotten more expensive. I believe more people will be uninsured because of the confusion and frustration. Obviously, the cost for insurance has gone up, and we've done nothing to improve access. We don't have more doctors and nurses. We don't have, more alternative ways of accessing medicine if you're poor or in a disparate community. So we're not solving problems. We're just spending a boatload of money and frustrating people.
40
how dare you question it because you're being an obstructionist by trying to figure out where this money is actually going.
$43,000 per person that doesn't pay for their health insurance, doesn't pay for their health care, pays for their ability to sign up.
It pays
That's
for
$170 million divided by 4,000.
the website, the servers, the little Paul Bunyan tattoos, Paul Bunyan being at the Mall of America. It's not actually focused on getting care to the people who need it.
That's because what I keep reading over and over, Senator, as I'm looking over like a legislation on the health homes, which are part of Obamacare and that sort of thing, is that they keep saying when in there, they say we have to evaluate the outcomes of spending the money this way and requiring these requirements. They say, well, we need to also incentivize people to come up with outcomes and evidence-based research that shows this works. In other words, they don't have a connection between this is evidence-based practice and this is an outcome that's going to work. Instead, they say, well, this sounds like a good idea, as opposed to actual evidence that says, yes, by requiring this, this is going to make a difference.
And Siri, you have now got into healthcare wonkery, like
I know.
One of the things
keeps me up at night.
Yeah, you two can have this discussion off air.
Yeah,
my eyes glazed over. What?
The Department of Health will say we have evidence-based practices. That's all the SHIP grants, which is a completely different conversation.
Language.
$30 million in statewide health improvement grants. They have to use evidence-based practices. And when I tried to put on something that said, no, you actually have to show us outcomes if you want to renew.
They don't have any. But Jack, that's the problem too with this insurance exchange is that they're making all these requirements and all this structure without actually proving that this is going to work.
No, Democrats never go into any bureaucracy they build with the intention of actually solving the problem.
Because it's not free market. It's a monopoly.
Good intentions plus a lot of money are sufficient for public policy on the left. And when you try to hold people accountable, then you're labeled obstructionist.
Right.
And so
because you're not the one. The Democrats are the ones who are at least trying. Well, they may be trying with horrible ideas.
How about
but at least they're trying.
I did tweet the phone number to State Representative Carly Moline for the show if she wanted to call in and explain the obstructionist thing. I don't think she's called in at this point. Ben, do you have State Representative Carly Moline on the line?
No.
You do not. Okay.
But one of the things that Siri pointed out, healthcare homes, accountable care organizations, our insurance companies are trying to be innovative and reduce costs. For whatever, you can malign their intentions, but those ideas were already moving forward in Minnesota. Some of the good things in Minnesota were actually copied in the ACA and then forced into Minnesota in a way that didn't work. We already had stable systems in place. We had one of the lowest uninsured rates in the nation. We had a high-risk pool where people were getting the care they needed at a marginal cost more than insurance would have otherwise been had they not had a pre-existing condition. And I believe it was Senator Sean Nenow, had a constituent who, yes, was paying a little bit more because he was in the high-risk pool, but being pushed into MSHA went up $1,000 a month.
Oh, my word.
Being pushed into MSHA.
Wow.
All right.
Wow.
Senator, we'll get the answer to this after the break, but do you know how many people we were told were going to be on MNsure?
Well, in order for the math to work, we
Don't
needed...
say it. We got to tease it. Do you know the answer?
So
Yes.
We'll come back with that. Hang tight. 651-989-5855. That number again, 651-989-5855.
more with Senator Benson on MNsure and more when we return. That's Jack. That's Siri. I'm Ben. Up and at 'em.
We are currently experiencing a high volume of calls.
Call back,
You may
Andrew.
remain on hold until your call is answered, or you may choose to hang up and call again at a later time.
Just trying to find
We
affordable
apologize
coverage.
for this inconvenience.
Well, you have... How many... This has been... you know who is behind this whole thing? Cell phone companies. Because you're going to wait on hold and pay for the minutes, and then eventually you're
Okay.
going to
That's the secret
You know what?
cabal.
No. I need to correct something. Both of you have said this now. Ben talking about paying for text messages with our contest that we had going on. You talking about paying for minutes. Nobody pays for minutes or text messages anymore. It's unlimited these days. You pay for data. Let's be honest.
Wow.
I said standard data message rates apply.
People have unlimited text messages
Depends
these
what
days.
plan you have.
All right.
There are people out there that
Okay.
have...
My
Look,
generation.
there are people out there still using America Online and dial-up modems.
Wait,
Siri,
what?
not everybody
So-
has your Cadillac plan.
Oh, stop.
Welcome back to Up and Adam. I'm Jack. That's Ben. That's Siri. We're here with State Senator Michelle Benson talking about the problems with MNsure, one of which being the hour-long wait. You get to wait for an hour, and then you are rewarded at the end with being hung up
Thank you for
on.
calling Minnesota Care. We are currently experiencing a high volume of calls. You may remain on hold until your call is answered, or you may choose to hang up and call again at a later
Are
time.
you actually still waiting?
Even people who need Minnesota care now have to wait too.
Yeah.
By the way, the counties can
I like how
handle
they
a lot of
phrase
the
that.
Medicaid Minnesota care stuff.
You may choose to hang up and call back. At another time.
And then
You may
it'll be
choo- you
your
may make that
fault
choice.
instead of ours.
All right.
It's in your lap.
And
Let's take that phone call.
Eric in Minneapolis. Good morning.
Hey, good morning. So, for months now, Obama and Sebelius have been going around characterizing the previous plans that were replaced by calling them substandard, deficient, etc. Now, on a continuum, one end you have one size fits all. On the other end of the continuum, you have market segmentation. It's the goal of every business and every industry to try and group together those customers that have similar needs, wants, etc., to offer them a more individualized product or service, right? But in this case, the health insurance product they're offering is one in the opposite direction. And it says, Eric, you need to have these minimum products, even though you don't want them, they must be included as features, and you have to pay for them. It is so frustrating to me that what he calls substandard or deficient was previously meeting the needs.
Thank you, Eric.
But-
Yeah, it's substandard if my uterus isn't covered.
But Eric, and this is just a general philosophy of, I believe, progressive politicians. They don't think you're smart enough to understand these things and make your own choices. And so they're going to decide what you need, and they're going to tell you how the problem's going to be solved, and then they're going to take your money and make you do it. And that is not the way markets work. That
No,
is
because
not
they
the way.
they base it on ideas, or ideas, not actually
Yeah,
what works.
philosophy, not
not reality.
actual accomplishments or execution.
2 weeks
Not
ago,
reality.
during our Ask a Liberal segment, the Liberal answered a lot of questions with a lot of ideas, and they sounded really good. But in practice, some of these things don't work out so well. Now, MNsure is covering 4,000 people who hadn't previously been covered under a government plan. What did they say they would cover?
Well, I'm looking at the actual fiscal note from the final bill as passed, and their plan for 2014 on the low end was to have 148,000 subsidized individuals and 16,000 non-subsidized individuals in the individual market. And then for the small group, that's the business market, 13,000 people. For the Medicaid program, 621,000. So that's the math that they gave us. That's the math that was sold as the bill was moving through. And what that leads us to is, how is this going to be paid for? You've heard about the salaries. There are...
Back to the numbers. It was supposed to be over 600,000, and it's at 25,000.
Right.
That's way off.
Yes. For the Medicaid population, though, there's not going to be a gap for those folks. The counties are working through that, and so some of that's happening offline, and eventually they'll get pushed into MNsure, whether they like it or not. But...
well, I feel like all of us are like that. You're going to get pushed into this whether you like it or not.
But here comes the next problem. How's this going to get paid for? Because this was supposed to be paid for a combination of federal funds, a 1.5% withhold from the individual market plans going through MNsure. So how...
Wasn't this being paid for by young, healthy kids signing up?
That's the insurance end of it.
That's how you stabilize the insurance pool, is by having young, healthy people in. Oh, let's stop right there a second. Young, healthy people, Minnesota's enrollment is, the median age is 50.
Whoa.
Median means that's the center. That means that half of everybody that's enrolled is over the age of 50.
Yeah, well, and remember, Medicare kicks in at 65, so nobody 65 and over is going to be in this. So the math for the insurance side isn't working out, but just for the operation of the exchange itself, there's not enough money coming in to sustain the operation.
But you know why young,
General
healthy people
fund.
like myself are not buying into this or not enrolling? One, because they're just, they're healthy. Why do I need to get insurance if I'm healthy and have to pay these huge prices for it? And two, I'd rather just pay a penalty that's a lot cheaper.
And I was talking to a group of college kids. Until they're 26, they'll stay on their insurance plan. Their plan is stay on their parents' insurance plan until they're 26, and by that time, have a job that provides them with insurance.
Right.
Exactly.
Now,
that's my plan.
in the original planning of this, that depended so much on the young invincibles, these young people who will be paying for health insurance, paying for health care, but not really using it a whole lot. It doesn't work out when you also allow those people to stay on their parents' health insurance, because who wouldn't pick that? So from the get-go, this was flawed.
If they'd been thinking about all of the pieces that they were moving, they would have realized that those two things work against each other.
But you can't sell it to young voters when you're running for re-election if you say, if you don't include the stay on your parents' insurance till you're 26 part.
Right.
Yeah. Phone call? Let's take it.
Dave in San Diego.
Hey, Dave.
Yeah, good morning, everyone. I got a question for Michelle. How is it that in the EBT cards, people can buy just about anything for food and that? You'll see them buying, the chocolate frosted sugar bombs for their kids. And then we wonder why we have unhealthy kids in the low income and subsidized, income areas.
Well, it sounds like we have a Calvin and Hobbes reader, because
I was just about to say
sugar bombs. But
thanks, Dave.
EBT cards have a couple things on them. There are food stamps. They actually have about 7 things in Minnesota. There are food stamps. There is TANF money that's supposed to help with bus fare. That's the equivalent of cash. Food stamps, we don't restrict snack food and soda. I actually had a bill to do that, but food stamp policy is made at the federal level. And so until the federal government says we're not going to let people buy junk food, they're going to be able to buy junk food with their food stamps. So,
And the more junk food they eat, the more health care they'll use.
And the downward spiral into single payer.
All right.
Not everything's
frankly,
a conspiracy.
And there are people who say that the screw-ups of Obamacare were intentional to get us into single payer. I don't buy that, because I don't think after this failure, the American people will stomach the government saying, okay, we screwed this up. The problem is we didn't have enough control. I don't think they'll buy it. That's the next push in 10 years. I don't think it's going to happen now.
I think they were going to move slowly towards it. And as they restricted access, they were going to say, look, the insurance company is not letting you do this. Your doctor, their doctors won't take the insurance you have. It's the doctor's fault. Guess what? Citizen, voter, consumer, person who needs health care, we, the federal government, are going to come in and solve this problem. The problem is it fell apart so quickly that they couldn't get the messaging out that they wanted to blame the insurance companies for everything. But it's been so obviously of failure,
Yep.
of massive progressive overreach.
Now, you mentioned people receiving subsidies. MNsure said the other day that there are 1,000 people who need to start over at the beginning and call MNsure because they did their subsidy wrong. But others, if you suspect your subsidy is wrong, you should call too. How do you know? Who should suspect that their subsidy might be wrong? If you're getting a subsidy, should you assume it could be wrong?
If you think you're getting a subsidy, you should probably check. I would say anything with MNsure at this point, you need to double and triple check. Until you actually get something in the mail from your insurance company, I would hold my breath, which makes for a really miserable Christmas.
Everybody call MNsure. They can't handle the call volume as it is. Wait on hold. I hope you like that song because you're going to be hearing quite a lot of it. We're not done with this. We'll go one more segment on MNsure with State Senator Michelle Benson. If you have a question, give us a call, 651-989-5855. And if you're on Twitter, use the hashtag TCNT.
That's Jack. That's Siri. I'm Ben. Up and at 'em.